VCU Health is home to the region's top Level 1 trauma center. Dr. Michael Abutanos, who leads the medical team, shares why he's equally passionate about the clinical care we provide to injured patients as he is about the injury prevention to keep you and your loved ones safe. This is Healthy with VCU Health. I'm Prakash Chandran, and today we're joined by Dr. Michael Abutanos, who's the Chief of Acute Care Surgical Services and the Chief of Trauma at the VCU Level 1 Trauma Center. Now, Dr. Abutanos, it's a pleasure to have you here today. So to start us off, I know that people listening might feel that all emergency care is created equal, and they might not have a choice to where they go when something serious happens. But I'd love to get your take on that and how it relates to the trauma center at VCU.
It's a very important question you've asked. There's definitely a choice of where you need to go and where you should go when you or your loved one is involved in an injury, whether it's a car crash or it's a fall or any kind of other injuries you may have. And so you have the choice to say, I want to be taken to VCU Trauma Center as an example. And it does make a huge difference of where you go. And this is why us at VCU Level 1 Trauma Center, one of the two main reasons where we think people should really go there, is what I would send my family, is because we have the most comprehensive and also the most experienced level of trauma care that you could have. And so this is incredibly important. Do you have what matters the most in trauma is time, our ability to be prepared and to get to the patient and deliver the highest level of care with the most experienced hand in order to be able to stop the injury, not having get worse and not lead to a very bad situation or circumstances or outcomes. And so definitely where you go extremely matters with regard to the outcome and how well you will do.
Yeah, that's very reassuring to hear. Next I'd love to learn a little bit more about what specifically separates the VCU Health Trauma Center from the other emergency care facilities in the area. I'm making the assumption that it comes down to the team of surgeons and nurses and the experience that they have. Is that correct?
I think it's a mistake that people only focus on, for example, the physician. It is really the entire system they have built together, the teamwork that we have set together, and most importantly, the experience we've had. We've been doing this for 30 years, where we have learned what works best, and some of the most toughest cases that would not have survived anywhere else, we have been able to learn from them and have survived in our hands and our experience. I think this is extremely important aspect. For trauma, you have to have excellent leadership, ability to have a very well-organized team, compassionate team. That's really important. And also a team that has done it before, have seen it. There's nothing new for us. And this is why I think it's extremely important to know where someone should go. I give you an example. I have one of my patients, for example, he was deer hunting. And he fell off a deer stand. Took them hours to get him to us. He had significant number of injuries. And he came in, he would not have survived anywhere else. Under our hands, he had 19 operations by the time we were able to save him. And what he received, not only the best surgical care, but also the phenomenal nursing care that he had in our intensive care unit. He was there for 2 months, where our ICU care was just top of the line, and he walked out of here. He's now one of my favorite patients. Comes back and sees me in the clinic. He got to go back to his family, and he knows, and he tells me often, I would not be here if I didn't say I want to go to VCU, and this is where I knew I would get the best of care. And I could tell you the story about 4,000 times of the number of patients that we see, about 4,300 patients a year that get admitted to trauma, and this is the care that we delivered. I tell you the same thing. My father, I think I mentioned this before. My father had a head bleed and from a fall, and he was in Pennsylvania. I flew him all the way over here for our team, to take care of him. Knowing very well this is where he'd get the best of care, and I had to stand back because I was now a family member. I had to step back and watch this team that I totally believe in take care of the person that I totally love.
That is incredible. And thanks so much for sharing that with us. One of the things that you said that resonated with me was, it's some people only focus on the physicians at an organization, but you really work as this cohesive unit. Everyone has a role to play in bringing a comprehensive level of care that frankly saves lives. So I'm curious as to what people might do before an accident happens to better prepare themselves and potentially, tell someone or write something down that says that they prefer to go to VCU Health when something like this happens.
Yeah, because it depends on type of the injury that you will have. Definitely have your family members also be aware where you like to go, because that's extremely important. When you're injured, a lot of time you're under a lot of stress. You don't have all your whereabouts. And so having something even in your ID, in your wallet of, if I'm injured, please take me to VCU, that makes a big difference. Telling your family members, this is where I really like to go. This is where I think I would get the best of care, so that everybody knows this. So the way that the system works, that the pre-hospital provider take you to the closest, most appropriate facility, because that's their algorithm, that outline where they need to go. But people don't know that they have the choice, and so if you could communicate the choice. If you feel you may not be able to be prepared, that everybody around you knows, if is this trauma, VCU is where to go, something like that. So there would be no ambiguity, for example, and not have an issue as far as, I really did not want to come to this hospital or to this other hospital. Right off the bat, if you're prepared, then things will go the right way.
Yeah, and it seems like there's a lot of education that is offered at VCU. I know you have the Center for Trauma and Critical Care Education program, so maybe someone listening to this can do some, pre-incident work to really just be proactive about the type of care they're going to receive, and like you said, update that medical card. Can you maybe talk a little bit about the CTCCE?
Sure. So our Center for Trauma and Critical Care Education has also been around for 30 years. It's goes back to the whole concept of teamwork. So almost about 30 years ago, we realized that in order for you to get the best of care in the hospital, you should get the best of care on the street as well. And we take our commitment to the community so seriously. We went to the General Assembly, were able to have the center created that we could educate all the pre-hospital provider, the paramedic, the EMTs, the firefighters, to train them so they could deliver the best of care on the street. And we take this education very, very seriously. And so we educate for close to 5,000 students per year. Students, by that I mean anybody who attend our center. So it's a significant commitment. We train almost one half of all the pre-hospital providers in the entire Commonwealth. And this is a huge service, but also speaks volume of how we are committed to have literally a community approach, not only a hospital approach. So we train all our providers to take care of you, to know what you need on the streets, in your home, whether you had a car crash or if you've fallen or you're injured in any other way. And we put our license on the line when we train them. They operate under our license. We take that seriously. It's a really comprehensive approach. It's what I talked about before. So we know if they get the best of care in the streets, in the ambulances, when they get to us, we continue that best of care here in our hospital.
Yeah, that really is a fantastic approach. One of the next things I wanted to ask you about was recovery and how it relates to the team that you work with, specifically around, how going to a trauma center like the one at VCU Health can help speed in the recovery process and get people back to a normal lifestyle faster.
That's our number one objective. The minute the patient gets in with us, the first thing we're looking at is how can we put them back to their family in a functional and a safe place. We know that's our objective from the beginning. So because we have a comprehensive approach, a multidisciplinary team, we have people who are involved with whether physical therapy, occupational therapy, rehab, already involved right from the beginning in the care of the patient. And so everything matters. So the fact that even though we have the most experienced surgeons and nurses and pharmacists and nutritionists, etc., as a team working very hard to get you better, at the same time we're working the social aspect of what can get you functionally better into the community. It's that, again, comprehensive way, holistic way of looking at the trauma patient. We don't just focus on the injury. We focus literally on the patient. So we focus on you, and when you get injured, where are you at, where do you live, what kind of structure you would need in order for us to help you get back to really the people that love you the most and that care for you.
Yeah, it really does seem like that comprehensive level of care and holistic approach that you take with your team is so incredibly important. And hearing you today, the one thing that I've learned is that not all level 1 trauma centers are created equal. And it's important to learn the capabilities and care of the hospitals in your area. And after talking with you, Dr. Abutanos, I'm definitely convinced that VCU Health is the place to go. So thank you so much for your time. That's Dr. Michael Abutanos, the Chief of Acute Care Surgical Services and the Chief of Trauma at the VCU Level 1 Trauma Center. Thanks for checking out this episode of Healthy with VCU Health. For more information, check out their website at vcuhealth.org/trauma. If you found this podcast helpful, please share it on your social channels and be sure to check out the entire podcast library for topics of interest to you. Thanks, and we'll talk next time.